Welcome to review of African research by MediMagSurgery.com. Today we review a research on the willingness and ability to pay for healthcare insurance among Africans. The research was conducted in 7 communities in East and West Africa by Bolarinwa and his colleagues. The research was published in PLOS Global Public Health Scientific Journal. What may have prompted Bolarinwa and his colleagues to do this research? Bolarinwa and colleagues are public health doctors and consultants. They know that healthcare financing is a major challenge in Africa. And many Africans do not get healthcare services. Most people in Africa pay from their pockets to purchase healthcare services when they fall ill. Less than 10% of the populace enjoy health insurance schemes. What does out-of-pocket payment really mean? In plain and simple terms, out-of-pocket payment means paying cash directly for healthcare services. If you have no money, you get no medical care when you are ill. Whereas, health insurance scheme means everyone gets medical care once they are registered in the health insurance scheme. To achieve universal health coverage or healthcare for all, African countries must shift from paying from their pocket to using health insurance schemes. Healthcare insurance systems are well established in many developed countries. To sustain their health insurance, the developed countries like the United States of America and United Kingdom generate huge tax revenues. According to a recent global report, to be able to generate enough tax revenue to finance healthcare coverage for all, African countries need to create new investments and sell goods and services worth over $120 billion per year. To illustrate, Nigeria will need $24.7 billion per year. Kenya needs $5.6 billion per year. Tanzania needs $1.9 billion per year, and Uganda needs $4.3 billion per year. Clearly, most African countries cannot generate tax revenue to support healthcare financing for all. Therefore, Africa needs to look to alternative means of financing healthcare insurance. An alternative is for individuals to contribute money monthly to care for all. For the contributory scheme to work, 2 things must happen. 1. The people must be willing to contribute a certain amount monthly. This amount is called the premium. 2. The people must also have the resources to pay the amount they pledge to pay. Therefore, Bolarinwa and his colleagues undertook the research. They interviewed 3,676 persons above 18 years of age, in 7 communities in Nigeria, Kenya, Tanzania, and Uganda. They sought to answer some questions which could help the government, policymakers, and persons willing to fund healthcare in Nigeria and Africa. They researched the following 3 questions, among others. 1. Will Africans participate in a contributory scheme to finance healthcare for all? 2. How much are people willing to contribute to the common purse per month? 3. Will people be able to redeem their pledges when they pledge to contribute? To know if people will participate in a health insurance scheme, they asked their respondents a direct question as follows. Would you be willing to participate in the health insurance scheme, and pay a health insurance premium for you, or other members of your household? They found that 3/4, approximately 79%, of people were willing to participate in a contributory scheme. But, only half, approximately 55%, were willing to pay for all members of their household. To know how much the people are willing to pay, again, they asked a direct question. What is the maximum amount that you are willing to pay, as the health insurance premium, for each person in your household, per month? The amount the respondents were willing to contribute varied across location and country. On the average, the amount the respondents were willing to pay was $2 per person per month. In Nigerian Naira, this means an average respondent was willing to pay between 850 and 1,200 Naira per person, per month, based on the exchange rate as of November 2021. To know if people will be able to redeem their pledges when they pledge to contribute, Bolarinwa and colleagues used an indirect assessment method. They compared the household income to the among pledged. If the among pledged was more than 5% of the household income, then the person was adjudged not to have the ability to pay. Based on this analysis, 57% of those willing to pay were judged to be able to pay. Conversely, the finding implied that almost half, 43% of the household are currently unable to sustain healthcare expenditures, and are more likely to suffer from catastrophic health expenditure if there is a severe illness. Who were those willing to pay? And who are those willing to pay more than the others? Self-employed respondents were more willing to pay than civil servants and unemployed persons. Self-employed persons were also willing to pay more, $5.50 per person per month, compared to civil servants, $3.11, and private employees $3.40. Households with elderly or female heads were less willing to pay. Women generally were less willing to pay compared to men. Widows were more willing to pay than single women. Those who already spend more on healthcare services were willing to pay more. The educated were more willing to pay compared to the uneducated. What did Bolarinwa and colleagues not consider in their research? They did not consider other needs that compete for the household disposable funds. Yet, these competing needs may influence willingness to pay and ability to pay for healthcare services. How does the results help the policymaker and health insurance companies? The research shows who will be likely to want to enroll in healthcare financing schemes. Thus it will help in mobilizing people into existing schemes. The research shows how much people may be willing to pay. Thus it will help insurance providers to plan and implement their premium schemes for better participation. The findings may also help policymakers, insurance companies and the government to identify people that may require subsidies to boost their participation. This research was published in November 2021. To find the article and get more details, follow the link shown. Thank you for listening to Metamog Surgery Review of African Research.